emergency.
I need help, please! Please help me!
We are sending out emergency services to your location. I'll stay on the phone with you until I get there.
Good afternoon, everybody. This is K1906 with the Tribe of Kings. I'm also known as the Medical Coordinator. Today, I'm presenting you your Medical Mondays. This Medical Monday is actually going to go over everything we're going to talk about for the next few Mondays. So straight into it, we want to talk about the copyright disclaimer. That's one of the biggest things. This is for educational and entertainment purposes only. Copyright disclaimer under Section 107 of the Copyright Act 1976. Allowance is made for fair use for purposes such as criticism, comment, news, reporting, teaching, scholarship, education, and research. Now for your medical disclaimer, because again, I am not a doctor. I'm the medical coordinator for Tribe of Kings. So this is one thing that's very big. Content is provided for informational purposes only and does not intend to substitute professional medical advice, diagnosis, or treatment. Your participation and or interaction does not establish any kind of patient-client relationship in any form during this broadcast. Now we're going to talk about your basic life-saving skills. One thing that's very important is everybody has these skills, but some are just scared or afraid to act upon them. Having a knowledge of basic first aid skills could save someone's life or even your own life or your family member's life. These skills are easy to learn and recall in emergency situations. So again, once you learn these skills, because they're very simple, they become second nature. Everything you need to perform these skills, you were born with. If you think about it, your brain, because you know how to think, your hands, because again, we're what we call kinesthetic. We love to use hands, we love to move around. Quick actions. For example, if something was going to fall, you will reach down and grab it. And your response. So again, you're born with everything you need when it comes to understanding and actually implementing these first aid skills. In an emergency, not only recognizing, but executing the skill is the biggest difference between life and death. If you see somebody choking, are you just going to sit there and let them choke? Or are you going to actually act upon that and try to save them or attempt to save them? So that's one thing that's very important. And another thing, when we're talking about these, this is real world, something you can always do, or I shouldn't say always do, something you can do on a daily basis. You may see a car accident. What can you do, or how can you intervene with a car accident to actually render first aid until medical responders get there? So again, this is something you can actually do. The 5 life-saving skills we're going to talk about beginning next Monday, and throughout that is going to be CPR. What is CPR? How we do CPR? The Heimlich maneuver. So again, if somebody's choking, if you're an adult choking or if a child is choking, how do you perform this task? Recognizing signs and symptoms of a heart attack, because that's one of the biggest things. So again, this could be a family member. If you know family members who have high blood pressure, diabetic, or may have suffered a stroke or something of that nature, or if they're eating bad food. So how do you recognize a heart attack? That's very important. The use of an AED. If you notice in the malls and all public places now, AEDs are all around us. So using the AED, you want to be able to use it properly and correctly. So again, give your inside look on that. Recognizing signs and symptoms of a stroke. That's very important because again, they can either have a heart attack or they can have a stroke. Both of these are what we call extreme 911 tasks. So again, if there's something from either a heart attack or a stroke, you want to dial 911 as fast as possible and you want to render aid. You want to help them out because again, that's the difference between life and death. Now, CPR, cardiopulmonary resuscitation. If you look on the right side, you're talking about chest compressions. You have your adult, your child, and your infant. And we're talking about the depth of the compression, about 2 inches for an adult, 2 inches for a child, and 1.5 inches for an infant. Notice the difference in the hand placement. For an adult, it's 2 hands. For a child, it's 1 hand. And for an infant, it's 2 fingers. So again, based on that body size, we determine what type of chest pressure we do. We do 2 hands, 1 hand, or 2 fingers. Perhaps the most well-known or maybe the most important first aid skill is CPR. Because again, if somebody goes down, you don't feel a pulse, what are you going to do? Hands down, CPR does save lives. Learning this skill is simple, easy, and takes about 5 minutes to do. So again, you do your chest compressions. Again, it's not talking about mouth to mouth. You just do the chest compressions, get the blood flowing everywhere. And that leads us to bullet 3. CPR provides artificial ventilation that can help preserve brain function, blood flow, and breathing. So again, you're pushing that good blood throughout the body because again, the heart is not pumping. If the heart is not pumping, oxygen is not getting to the brain and the vital organs. So you're actually pumping for the heart itself, which is help push blood flow through all the major vessels. Having knowledge of CPR and performing it correctly in an emergency situation is invaluable. So again, if you can perform CPR and somebody's down and they do not have a pulse and AED is not readily available, please do it. Now, the Heimlich maneuver is something we do when somebody's choking. When a person is choking or what we call the airway obstruction, air is not able to pass through the throat into the lungs, thus preventing oxygen from flowing to the brain. Air obstructions can be caused by any foreign body, including food, large enough to include the passageway. One thing that's very unique is it's more common for infants and children to choke on toys and things of that nature because, again, they're always curious. However, for adults, it's more common for us to choke on food because, again, we know we're not going to put toys or whatever in our mouth. But when it comes to food, if we're not chewing up properly and we swallow it, yes, we can be a choking hazard that way. The Heimlich maneuver is performed to clear the passageway. Upward thrust applies pressure on the diaphragm, which then compresses the chest cavity, forcing air out of the lungs through the windpipe, dislodging the object. If you are by yourself or no one is around and or no one is willing to help, you may need to perform the Heimlich maneuver on yourself. And we're going to get in more details about that in our Medical Mondays. This skill has proven to provide extremely high success rate among children and adults. In some instances, an individual will become unconscious. If that person becomes unconscious, because again, there's a lack of oxygen going to the lack of oxygen or blood flow going to the brain, they're going to pass out. If they pass out, lay them on the ground. Once they're on the ground, check for a pulse, because it defeats the purpose of doing chest compressions on somebody that has a heartbeat. If there's no pulse, then you need to start CPR. If a pulse is present, you then need to continue performing the Heimlich maneuver. So again, we're actually going to get in more details about that later. Now for a heart attack. There are so many signs and symptoms of a heart attack. Cardiovascular disease, or some people say heart disease, is one of the leading causes of death globally and predominantly in the African American community. Because again, we love our seasoning, we love our fried food, fried fish, Friday, Saturdays, things of that nature. So we eat a lot of this food. Cardiovascular disease are disorders of the heart and blood vessels and include coronary artery disease, cerebral vascular disease, and rheumatic heart disease. So basically, you're clogging your arteries by eating these high cholesterol or high fat diets. This is the major problem. A large majority die from heart attack or stroke, especially if these signs and symptoms are not identified early enough, they will die. One personal for me is my mother. My mother had a 98% blockage. So she had a massive heart attack and she didn't know it. The one thing she was just saying, she was having discomfort, didn't have the arm pain or anything of that nature, no shoulder pain, but she's diabetic. So she had what we call a silent heart attack. Just had she had a slight discomfort. So again, she misdiagnosed it. I said, hey, you're going to call 911. Call 911. Medics got there, put her on EKG. Noticed she had what we call a widowmaker. So she was having a massive heart attack. Not all heart attacks involve chest pain, even if discomfort is present. Many diabetics, like I was saying before, suffer a silent heart attack, which tends to be misdiagnosed. So it's important to know your family members. Knowing what to look for can reduce that risk. So again, it's very important to know what to look for when it comes to this. You want to be able to identify these signs and symptoms early to help save that life. How to properly use an AED. So when it comes to this, it's very important to take first aid and CPR. And first aid and CPR, they're going to teach you how to use an AED. So again, this is just a general overview. Your AED, or we'll call it an automatic external defibrillator, is a portable electronic defibrillator that automatically recognizes those life-threatening heart arrhythmias of ventricular fibrillation. Now, we're not going to go in a lot of detail with that. All we're saying is the heart's not pumping like it's supposed to and it's quivering. That's like saying, let's say, ball your fist up for a second. Yeah, just ball your fist up. Now, with that, just shake that fist back and forth. That's what the heart is doing. It's just quivering, so it's not pushing blood throughout the body. And because of this, it needs to be reset. And that's what the AED does. An AED can provide life-saving intervention if an individual is having a heart attack. Sorry, I need to fix that. Remember, when sudden cardiac arrest, when it comes to sudden cardiac arrest, the heart is not pumping the blood. So a shot needs to be administered to help reset that heart. That same thing as if you're not getting enough blood flow to the body has a fail-safe mechanism. So you'll pass out. Once you're in that, what we call that supine position, the body resets itself, blood is flowing back into the brain, and you recover. We'll call it a syncope episode on the medical side. So again, if the heart is not pumping like it should be and it's quivering, the AED will actually administer a shock to help reset that heart. The use of an AED combined with chest compressions provide a greater chance of survival. So you've seen instances of this. You heard cases of this. So again, the AED is not right there. Start those chest compressions. Once the AED arrives, place it on properly, back up, let the AED do its job. The AED literally walks you through everything. When a defibrillator is present, use it first by following the prompts. So again, it's not like you have to memorize. You have a brain, you have hands, you have quick response. So follow the steps that it's telling you to do. Obtain the proper trainer will guide you through the steps so this may help you save a life, because you never know when you would need to use an AED. Now, signs and symptoms of a stroke. If you look on the right side, it says, if you suspect a stroke, be fast. So when it comes to this is what we call an acronym. The B stands for balance. When that person is standing, do they have weakness on one side? The E is for eyes. Has that person lost vision in one or both eyes? Now, when you're looking at the face for the letter F, does that person have an uneven symmetry? So if you're looking at their face, is one side drooping? Not if they have Bell palsy, because that's different, but if they normally have symmetrical face, symmetrical features, now all of a sudden you notice one side is drooping, there's a problem. They could be suffering a stroke. Arms. Can that person extend both arms out for about 10 seconds? And if they do, and one arm actually drops, then that could be a sign of a stroke. Listen to their speech. So when you're talking to them, they tend to slur their speech because of a facial drooping. So again, please pay attention to that. And then T is for time. Time is of the essence, because when they're suffering from a stroke, there is a blood clot in their brain. And if we're not able to get that person to the hospital in time, that vessel could rupture and cause that person to die. The easiest way to give a better image of this would be, think of a water hose, and in that water hose, there's a knot. And because there's a knot there, the water's not able to push through that knot. So pressure and pressure and pressure is building up and pushing on that knot. That water's not able to go anywhere. So it finds the weakest part of that vessel and it bursts, boom. That's like in the wintertime when your pipe rupture. Similar to that. So again, you want to be able to identify these signs and symptoms of a stroke as fast as possible. Just like it says, call 911. You want to try to prevent any types of bad medical outcomes. Now, like I said before, brain cells begin to die within a few minutes due to the blockage. So there's a lack of oxygen getting to the brain. So because of that, brain damage can occur. So you want to call 911 as soon as possible. Strokes can occur at any age, but the risk increases as you get older. It is important to recognize the signs and symptoms of a heart attack and a stroke so that timely treatment can be initiated to help save a life. So that's going to be the biggest thing. Time is of the essence. So what we say on the medical side is time is muscle. The longer you take to actually respond to that medical emergency, the more muscle they're losing. So if they're having a heart attack, the longer you take, the more muscle in their heart is dying. So they will eventually die of a weak heart. Same thing when it comes to a stroke. The longer you take to respond to call 911, the more likely they're going to blow a vessel. And that's going to cause them to die later on or brain bleed. And we want to prevent that. That concludes our overview of Medical Mondays, covering the 5 life-saving skills: CPR, high leg maneuver, recognizing signs and symptoms of a heart attack, use of an AED, and recognizing signs and symptoms of a stroke. Beginning next Monday, we're going to dive straight into CPR, followed by the remaining 4. See you next Monday.